The muscles used for mastication, our fancy word for chewing, move the mandible around to grind the lower teeth against the upper teeth. That cuts or crushes the food that's in between. For speech purposes, the role of mastication muscles are going to be to raise or lower the jaw. Our mastication muscles include raising muscles like the masseter, the temporalis, the medial pterygoid, lowering muscles like the digastric, the mylohyoid, the geniohyoid, and the platysma. The lateral pterygoid is more specifically involved in chewing only. The masseter muscle is a large muscle that is the most superficial of the muscles of mastication. It originates along the zygomatic arch and inserts into the ramus of the mandible at the angle. This will elevate the mandible by closing the jaw and applying the greatest force to the jaw in the region of the molars. So in chewing and swallowing, it's used for grinding actions. The temporalis muscle is deep to the masseter and passes underneath the zygomatic arch along the temporal bone. It originates along a broad fan from the lateral, frontal, parietal, and temporal bones and inserts into the coronoid process, the thinner blade-like projection on the front part of the ramus of the mandible. This will help elevate the mandible and also potentially draw the mandible backwards. The medial and lateral pterygoid muscles share a name because of their origination under the zygomatic arch on the sphenoid bones, those little pterygoid legs that hang off of it, but they have fairly different functions. The medial pterygoid muscle inserts into the inner side of the ramus of the mandible near the arch and helps elevate the mandible, similar to the masseter, whereas the lateral pterygoid muscle courses posteriorly to insert just under the condyle of the mandible. So given its course, its primary function actually is to pull the jaw forward, which, unless you're excited about sticking out your chin for some reason, its primary function is going to be in the grinding actions for chewing rather than specifically being involved in speech. So when we talk about moving the jaw for speech or for chewing, our primary dimension of movement is superior-inferior, moving the body of the jaw up and down, rotating around the joint formed by the condyle with the temporal bone. The masseter, the temporalis, and the medial pterygoid muscles are going to be our jaw-raising muscles for this movement. Jaw lowering will happen through action of digastric, mylohyoid, geniohyoid, and platysma, which will be talked about in a minute. We do have some anterior-posterior dimension of movement for the jaw from the combination of the lateral pterygoid and the temporalis as prime movers and antagonists to one another. This would mostly be used in the grinding motions of chewing. We also have some medial lateral movement possible by the combination of the medial pterygoid and the masseter muscles, making a sling at the angle of the jaw. So if we want to move the jaw left or right, or again, for a grinding type action for the teeth from left to right or right to left, the medial pterygoid and the masseter would be our prime mover antagonist pairs for these movements. The digastric muscle we've seen before as a suprahyoid muscle. It has an anterior belly that comes from the inner mandible near the symphysis that courses backward and downward to the hyoid bone where it joins the posterior belly via a tendon. The posterior belly comes from the mastoid process of the temporal bone and courses downward and forward to the hyoid bone. When both of these bellies are contracted and the hyoid bone is stabilized by infrahyoid muscles, the digastric muscle will open the jaw. This image of a plastic model of basic jaw muscles gives a fairly clear view of both the course of primary muscles as well as the layering of the muscles in terms of their superficial or deeper location. So we can see the temporalis and the masseter on the left from the outside. As we remove those external pieces and look underneath, you can see the courses of the medial and lateral pterygoid, as well as the L shape of the digastric, connecting your jaw to the mastoid process on the temporal bone. The mylohyoid muscle was another suprahyoid muscle. This muscle originates from the mylohyoid line on the inner side of the mandible and courses medially to the median fibrous raphe and the body of the hyoid bone. If the hyoid is fixed by infrahyoid muscles, contraction of the mylohyoid will help lower the jaw. Remember also that the mylohyoid muscle acts as a muscular sling underneath the tongue, so it basically holds the tongue up within the oral cavity. The geniohyoid muscle originates from the inner side of the mandible near the symphysis, runs inferior to the genioglossus muscle and superior to the mylohyoid muscle, courses backward to insert into the corpus of the hyoid bone, basically runs very similarly to the most inferior and posterior fibers of the genioglossus muscle. Once again, if the hyoid is fixed in place by infrahyoid muscles, the geniohyoid muscle can help open the jaw by pulling on the ramus of the jaw near the symphysis, causing rotation around the joint of the condyle with the temporal bone. The platysma muscle is a wide sheet of muscle over the neck and lower jaw. It's relatively superficial, comes from the fascia of the pectoralis and the deltoid, and inserts across the lower margin of the mandible all along the jawline. When this muscle is contracted, it will assist in pulling the jaw down. If we think about some of the functions of this muscle, like when you go to the doctor and say ah, and want to open the mouth up as much as possible for a visual inspection, among the various muscles listed here, Masseter, medial pterygoid, temporalis are all jaw-raising muscles. The one jaw-lowering muscle in the bunch is the mylohyoid.